Passive rhythmic stimulation from the feet lying on back. Option 1, stimulation from the toes. Option 2, from the shins. And option 3, holding under the heels.
Passive stimulation from the knees while lying on back. Option 1, stimulation from the top of the knees. And option 2, stimulation from behind the knees.
Passive stimulation from the hip in the fetal position. Place your hands right on the bottom of his hip.
Passive stimulation from the rib cage. Option 1, caregiver places hands on near side of the rib cage. Option 2, caregiver places one hand on either side of the rib cage to create motion. And option 3, caregiver places hand on far side of the rib cage to create motion. Passive rolling of the bottom while laying on the stomach. Caregiver places hand on the bottom to create motion. And it's important to ensure that only the lower back is moving and that there's no accessory movement of the shoulders and head. And if there is excessive motion of the upper body and the head, caregiver can place hand on the upper body in the back to help reduce extra motion.
Rotation of the head from one side to the other. The client lays on his back and rotates his head from side to side. It can be made in 2 different ways, slowly with large movements, or small, quick movements. Sliding on one's back. The client lays on his back and facilitates the movement by pushing his feet. And if you're not getting the proper head bob, it's okay to help facilitate and assist with the bobbing of the head.
Rotation of the legs to make the big toes meet in the middle, also known as windscreen wipers. The client should lay on his back with feet about 4 inches apart, and it's important that both feet are symmetrical. Ask the client to rotate his legs to make the big toes touch in the middle, and the movement should be made with large deflections of the feet from the middle to as close to the floor as possible. Rolling the bottom from side to side. So child lays on their stomach with their head resting in their hands. It's important to note that as the child rolls his bottom from side to side, that only the lower back and the bottom are moving, and that there's no extra movement of the shoulders, upper neck, or head. If the child is having trouble getting the movement started, the caretaker can put a hand on the bottom to help get a rhythm going. And if there is a lot of excessive movement of the shoulders and head, the caretaker can rest a hand on the back to help decrease that motion as the child continues to roll his bottom from side to side.
Rocking the body longitudinally lying on the stomach. The client is positioned with their face down and their hands level at their ears, and the elbows are facing away from the body with their palms flat on the ground. The movement happens by allowing the palms to pull the body forward and backward in a rhythmical motion. Another variation of this movement is to have the client with their legs straight and their toes in a 90-degree angle, still allowing the movement to come from the palms of their hands. Third variation is for that client to lay with their hands by their side, toes in a 90-degree angle, allowing the movement to come from their toes.
Thumping head into a pillow. So for this motion, the client lays on his back and rhythmically thumps his head into the pillow. The motion can be done with small movements of the neck or larger movements of the neck, as long as the motion remains rhythmical. It's also important to make sure that the client remembers to breathe during this exercise. Your heels up. Crawling. The client lays face down with his forehead in his hands. For this motion, he will pull one leg up to the level of the knee on the other leg. When returning the leg to start position, toes need to remain in contact with the ground. Both heels need to stay pointing up towards the ceiling during the whole exercise while remaining in contact with the ground, and it's important to make sure the bottom stays as close to the floor as possible.
Cat arches. The client starts with their hands and their knees both on the floor, knees together, arms slightly bent or completely straight, and you will ask the client to slowly sway their back and lift their head forward or up into the air, and then slowly arch back and lower head to the floor. And the client will just continue these movements in a smooth, rhythmical fashion. Good job.
Somersault rolling. So client will start positioned on his hands and knees with his head on the floor and hands beside his head. It's important that he keeps pressure and puts more weight on his hands and elbows as he rolls from the top of his head to his forehead.
Rocking on hands and knees. Client sits on his heels and stretches his arms forward. He then rocks back and forth until his head is right above his hands, and then bounces back and forth from his heels back up towards his hands.
pulling oneself forward with one's hands. So for this motion, client will be sitting on feet on his bottom with hands about 20 inches in front of him. To create this motion, client needs to stay put and without moving, push and pull with the palms to help remind that the movement is only in the middle area of the spine. The caregiver can put a hand on this part of the spine in the middle of the back to help remind the child that this is where the motion should be concentrated, with just a curving and then straightening of the thoracic spine.
Sitting on heels. The client sits back on his heels and leans forward slightly with arms raised in the air. He sags and arches the lower spine, and only the hips and lower spine will be moving. If you notice that the child's hands or body is shaking slightly, then the movement is being done correctly.